People who have had transplants and their caregivers speak about their experiences in this program. The patient seen demonstrating the transplant process is an actor. The following information is an educational aid only. It is not intended as medical advice for individual conditions or treatments. Your experience may differ from the experiences depicted in this program. Talk to your healthcare provider before following any medical regimen to see if it is safe and effective for you.
Things got pretty tough after about day 6 or 7, and they were tough for some days after that. But mentally, the thing that both Terry and I had to do was kind of keep our eye on the prize. That we knew we were going to come through the procedure, and the disease would be the one that suffered more than we did.
The first weeks after a stem cell infusion are usually the most challenging part of the transplant process. That's when you experience the unpleasant side effects of your conditioning. But your active participation in your recovery is crucial to your health and the success of your transplant.
It is true that once we begin the transplant, that it is important to follow through with all of the tasks that are in front of the person. It is very much like taking a parachute jump out of an airplane. Once you decide to take that parachute jump, it is very important to pull the ripcord and deploy the parachute. That is not the time that they can change their mind.
Your caregiver also plays a vital role. You will definitely need someone staying with you, dedicated to helping you through this time. If you cannot arrange for someone to help you, talk to your healthcare provider well in advance about possible options.
I had to help him take care of his Hickman catheter, clean the line. I had to make sure that he was getting all of his medication, and I would measure all of those out on a daily basis and make sure that he got them at the right times and the right amounts. I had to make sure that he got to all of his appointments. Physically, that he would eat and drink, just basic physical things I had to help him with.
The caregiver provides an important role of a second set of eyes for the patient as they are undergoing their transplant. We don't expect a caregiver to be a nurse or a physician, but we expect them to be an observer and a helper to the patient who is in their care. They need to be ready to ask questions for the patient if the patient isn't asking enough questions, and then they need to be that additional set of eyes that can look at a person and say, gee, you don't seem to be doing as well as you say you are. Maybe we should call the nurse and find out if there's anything else we should be doing.
You'll need to stay near your transplant team for 3 to 6 weeks or longer for continuing care. Make sure you faithfully follow the daily routine they prescribe for you. That routine includes seeing members of your transplant team at least once a day. It's important to be on time for those appointments. That helps your providers keep your care and that of other patients on schedule. Still, it's a challenge to see everyone at their appointed time every day. Sometimes people like yourself need unexpected tests or treatment. So some days you may be in the waiting room for a long time. Your punctuality and patience are much appreciated. Your healthcare team will examine you and check your blood for signs of infections or other problems. They'll also look for signs that your transplanted stem cells have begun producing blood cells, or engrafting. Your blood test results are typically discussed at your next day's appointment. Depending on the results of your tests, you may get a call later in the day asking you to come in for a blood transfusion or other treatment. You'll probably begin experiencing the side effects of your conditioning around 3 to 7 days after your stem cell infusion. Common side effects include fever and chills, nausea, vomiting and diarrhea, fatigue, dehydration, painful mouth sores, and hair loss.
The hair loss wasn't a big deal for me. I was pretty minor. You know, there were other things that were huge, and I was worried about getting mouth sores, and I was worried about spiking fevers and viral pneumonias and all those, and losing your eyebrows seems pretty small compared to all those.
Because of your weakened immune system, you need to be especially cautious about catching infections. Ask your healthcare provider for ways to protect yourself from germs. For example, caring for your mouth as instructed is very important to preventing infections. Wear a mask whenever you're outside your living quarters. If you eat out, choose a time when there won't be many people in the restaurant. Sit as far away from other people as possible. Your blood tests will show your healthcare provider when you can stop wearing a mask. The side effects of conditioning can make it challenging to follow your daily routine and protect your health. You might not feel like eating or have trouble keeping down food, but it's important to get proper nutrition and keep up your strength.
I remember the diarrhea and the feeling of nausea were probably the biggest, and perhaps personally my biggest challenge with the transplant was my inability to eat and drink. I just had to fight through that.
It got to the point where instead of asking him what he felt like eating, I just made something. And I tried to make things that were fairly basic, pretty bland, not real spicy things, not real exotic things.
There will be a day when you will wake up and you will think, now what is that feeling? And it will be that you're hungry again. And it's a wonderful day.
You might feel like staying in bed all day, but it's important to have as much physical activity as possible.
You just have to do it, one foot in front of the other. If you can keep from being in a wheelchair, that's great. And some people can't. If you can push the wheelchair and walk behind it, that's helpful. But keep walking. That's the one thing I remember the coordinator emphasizing for me. Keep walking. We don't want your lungs to fill. We don't want you to get pneumonia. Keep walking.
You just kind of want to lay around all day, but you just need to tell yourself that if I'm going to get better, I need to do these things.
A number of medications will be prescribed for you. It's important to know the name of each one and its purpose. Some are to help prevent infections. Others are to help provide some relief from side effects. For each of your medications, carefully follow the directions for how much to take, when to take it, and how to take it. Most of them must be taken every day.
It is extremely important for a person to follow the directions and follow the course of treatment that has been recommended to them as closely as possible. For one thing, if the physician or the caregivers are unaware that a person is not doing particular things or they are not taking their medications in the prescribed way, there may be an assessment that a particular drug is not working when in fact it isn't being taken. So a dose may be increased, a drug may be changed, when in fact the original drug was being perfectly effective, it just wasn't being taken.
Between your daily appointments, your healthcare team depends on you to immediately report any change in your condition. Make sure you have the phone number for the nurses' station at the hospital. You can call anytime, day or night.
Should you start developing shaking, chills, fever, or the feeling that you are about to get a fever, or that something's just not going well and going right, don't hesitate to call, get in and be seen. The worst thing that could possibly happen is that we see you and that you're fine and you've wasted a few hours in the clinic or the hospital. But it's better to check and be sure.
Throughout the transplant process, be prepared to go to the hospital on short notice. Keep an overnight bag packed and waiting. It's not uncommon for transplant patients to stay in the hospital briefly for treatment, such as receiving antibiotics, pain control, or nutrition. This is not a sign of failure. It can happen even if you're doing everything you've been asked.
There's ups and downs. But you do have good days, and there are bad days, and little setbacks aren't nearly as bad. And we were very fortunate. Andrew didn't have any major complications at all with the transplant. He sailed through it pretty well.
If all is going well, you're getting close to the final stage of the transplant process. In the coming weeks, turn to your caregiver and transplant team for help in keeping up your strength, your health, and your spirits.